Okay, beware. Things to be aware of when it comes to ACA and health reform. Hey, I'm Rebecca Gordon here at Gordon Marketing. And as we start to really get into trenches, we have people who are now enrolled. We are it's what I like to describe to my marketers. Now we're all kind of smart. We're way smarter. So now what we have to do is we have to figure out the pitfalls, right? We have to figure out what to be aware of. And big one when you're looking at policies is the PPO versus HMO. You have to understand one thing. When carriers have no idea what to expect in January or all throughout 2014, yeah, if they're going to be in this market, they have to take everybody. You know, and I heard a clever person say at a meeting, starting January 1, I just got a little bit of diabetes. And I just also got a little bit of rheumatoid arthritis. I got a little bit of high cholesterol. I got a little bit of cancer. Because everybody's guaranteed issue. So as a person who has good health, I am now assuming all that risk. I thought that was very clever because it's true, because I'm going to be paying for all of that. Since carriers don't know what to expect, and keep in mind, our insurance companies, no matter how much you love or hate them, they are a business, and their bottom line is to make a profit, right? So health insurance has always been assessing risk, deciding if it's a good risk, is it a good return on their investment to take that risk or not. Since they don't know what to expect, it's interesting that we're seeing carriers create or do different things to help with their risk. Biggest one, PPO versus HMO. So there are carriers out there who will still have a PPO, which is awesome. We have all grown accustomed to PPOs in the under 65. You know, here in Indianapolis, all doctors, all hospitals, you never have to worry, right? The competition has driven it so the PPOs are super strong. Now we're starting to see some carriers opt for HMOs. And at first I thought, that's so weird. Why would you do that? And this is why they do that. It's very smart. Carriers don't want the high-end risk people, right? They don't want that. They don't want the person who's has a bazillion pre-existing conditions. So by going to an HMO route and making it more narrow, possibly for specialists or doctors, they know that the person who really is going to be utilizing their health care, if faced with either or, they're going to go with this one. So it's kind of a way for a carrier to select what kind of risk they're looking for. I personally think it's brilliant because it will start to sway more business this way. Keep in mind, all of these policies, they have to be refiled every year. So if this model works out for some carriers, they may keep their networks. If it doesn't work out, maybe next year they're all PPOs. Who knows? But be aware of that, and then know who your HMO is, know the locations. If your people travel, if they're snowbirds, I would never want an HMO, ever. I'm too active, I love to vacation. No possible way. I would pay more to have the peace of mind with a PPO. Two, another thing I've seen is the drug list, the formulary list. There are some carriers that will have a closed formulary list. And again, I had to scratch my head and wonder why would a carrier do that? Again, it is to select against higher end conditions. So a closed formulary list is this. If your client is taking high-end drugs, probably tier 3 or 4, and it's a formulary, something's wrong with them, right? I mean, they've got a fairly significant pre-existing condition. A closed formulary list says, look, if your drug isn't on our list, no coverage at all, ever. No, done. Again, that will cause that consumer, if their agent is educated enough, to say, I don't want to go with this carrier. Yeah, the rate's less, but they're not going to cover my drug. Therefore, it's transferring the risk to another carrier. So be aware of that lingo. I think it's smart. I always say if it's going to be the government or an insurance company, I'm going to put my money on an insurance company. They're just smart. I'm going to say that. Certified. Make sure you are certified, all right? Make sure you are certified. I had an agent call me today. She said that she went on AHIP. She paid $150 for the core exchange. And would that carry over to the exchange I'm talking about? And I said, I don't know what you're talking about. And she'd already paid $150. And if you are in a federal state, and there's about 33 to 34, the certification guidelines are on our website. There's 2 phases, phase 1, phase 2. Very straightforward. If you need step-by-step instructions, you need to call or email me. I've sent out a blast email, step by step by step for both phases. If you're in a state-ran exchange, I can't help you. You need to call your Department of Insurance and get their guidelines. But I don't get a certification list. Unlike the MA market, I get a list of my agents and make sure they're certified. Otherwise, they'll get in trouble. So if you write a bunch of business and it turns out, by golly, you didn't do all your modules, game over. So make sure you're certified. Make sure you have a certificate. And then once you're certified, make sure you link yourself to the carriers that you're going to sell on exchange with. You got to link yourself. Nobody's really helping us out here on making sure that we get paid. So you better take those extra steps to make sure you are linked. And again, I wouldn't let your agents or your clients call in on that 800 number without you right there, because they're going to get a navigator and they're going to get navigated away. Good luck. Call me. We're here to help.